Good evening, everyone. It is Monday night, March 18th, and it is the night before I have my tissue expander surgery. If you follow me on Instagram, you probably already know the results of my CT scan. What a whirlwind, or I don't even want to say whirlwind, just like a stress overload day today was, because I was expecting to get the results like first thing in the morning and I didn't. And then once noon rolled around, I still didn't have any results. So crazy me, I mean, hey, the squeaky wheel gets the oil, right? So I messaged and called every single one of my doctors that are in my team. So my oncologist, my breast surgeon, and my plastic surgeon. And I was like, can one of you just expedite these test results? Because I need to plan if I'm having surgery or not. I have to plan mentally prepare for that because it's a lot. I have to plan for childcare, who's going to pick my daughter up from school. I have to plan for somebody to go with me, someone to pick me up, because my mom is going to stay with my daughter because I think that would keep her the most comfortable, because my last surgery, it was such a long surgery. This one won't be that long, but it was a lot for her. She's only 4 years old, so it really like stressed her out knowing that mommy was not around for breakfast, lunch, and dinner and bedtime. So now that she's in school, she'll at least be distracted during the day and having fun with her friends and learning and playing and all that great stuff. But I should be home dinner time. Don't quote me on that. I mean, you never know, right? Because I thought I'd be home at dinner time last time and I wasn't. But the only difference is this surgery is just the tissue expander surgery. My bilateral mastectomy, I had 2 surgeries. The surgery was supposed to be like 4 to 5 hours long. It was 7, because you have the breast surgeon remove your breast tissue, then test the lymph nodes, send it to pathology, wait like 40 minutes to an hour. Here I am on the table, knocked out, waiting for pathology. Okay. So that's almost an hour of nothing. Then they had to remove my port. So that's another little thing. And then that stupid sac that they thought was an infection, but was not an infection, got all over the place. So they had to clean me up, then sew me up. So it was a long surgery, and I didn't even get the expanders in for that one. So that's why I was home at 1 a.m. that night. It should not be like that at all tomorrow. So the good news is my CT scan finally did come back at 5 o'clock p.m., like literally the end of the workday. Had to sweat it out all day. And I posted the results on my Instagram, but I will also post the results here. It says basically there's no cancer present in my chest, pelvis, or abdomen. So that is a relief. My bone scan was clear. Now, I don't know if insurance will approve a PET scan because there were no findings. So what do you need a PET scan for? How about I just want to make sure there's no microscopic cancer cells on a cellular metabolic level? How about that? Because I had a lot of positive lymph nodes. So I might just pay for the PET scan out of pocket if it's not like $80,000, just to have peace of mind. I'm sure my doctor will appeal the denial since I did these 2 tests, and maybe insurance will approve it, but if not, figure it out, because I would like to know, like head to toe, if there's anything, but it's probably fine. I just want to have peace of mind. So yeah, I'm getting ready to go take my shower. I have to wash my whole body with my regular soap and then focus on the chesticle area with the Hibiclens, which is that special soap that my plastic surgeon gave me. And then put clean clothes on, obviously, go to sleep, wake up, take another shower in the morning, and just don't use my regular soap. Just wash the chesticle area with the Hibiclens again. I have 2 bottles. So the first bottle will be tonight, second bottle will be tomorrow. Surgery is scheduled for 12:10 p.m. And knowing how it went last time, I may not get wheeled back until 3 o'clock in the afternoon. Meanwhile, I'll be fasting the entire time and starving and getting impatient. But anyway, I'm gonna go because I'm gonna take my shower and get to bed soon and make sure my hospital bag is packed. I don't put that much in my bag because it's a same day surgery, so there's not really a ton to prepare for. I just hope I don't throw up this time from the anesthesia. Note to self, don't drink anything with bubbles in it, because that's what I did last time, like a idiot. Like, I don't even drink stuff with bubbles, but when I woke up, I'm like, I want a diet ginger ale. Why? Why, Brie? Why would you put all that gas in your empty, starving stomach? Never again. I'm taking one of my protein shakes with me, and I'm drinking water. Water and a protein shake. I don't want crackers. I don't want cookies. I don't want any of that processed junk that they give you when you wake up, and juice and just glycemic spike. Let's spike that insulin. And no, I'm good. I don't need that. I am not putting that processed crap in my body after what I've gone through. No. And that is honestly like the worst thing to do. Like, we're starving and you're on anesthesia. Why would you offer cookies and crackers, like all carbs, like carbohydrates? That's going to spike your sugars. You'll feel good for a hot minute and then you crash. That's the whole point. You need protein. You need like health. Like, I mean, you're not going to sit there and eat a green pepper, but like, you need healthy stuff. Like stuff that's not going to spike your blood sugar so high and then make you feel nauseous in 20 minutes because you're having a crash. Ugh, don't get me started on the food. So I was going to bring a string cheese, but I don't know how to keep it cold all day. It'll just be weird. So I'm just going to bring my protein shake and ask them for a cup of ice or something, and I'll just pour it on that. So that's my plan. Tomorrow it will be like a normal day for me. In the morning, I'll take my daughter to school, come home, get my bag together, and then my aunt is going to take me to the hospital and hang out there until I get wheeled back for surgery. And then another aunt's going to come and relieve, I have a lot of aunts, and relieve that aunt. And I don't know if my mom's going to come up. I don't know. But I am going to FaceTime my mom and pray with her. So, because we always pray before I have anything cancer related or surgery related. So I will pray with her, and I will do my best to record as much as I can and bring you along my tissue expander insertion surgery. And I get to wake up with iron boobs. I heard they're really hard and uncomfortable, but I don't know. I'm all healed from my mastectomy, so I'm hoping it's not too painful. My plastic surgeon said, she's like, not painful. They're just not the most comfortable. So I'm like, all right, can't wait to do this. Let's go. So I'm ready to roll. I will see you in the next clip. Good morning, friends. If that didn't scare the you-know-what's out of you, I don't know what will. No, I'm just joking. Look at my hair coming in. Isn't that cool? Anyway, guess what it is? It is the morning of surgery day for my tissue expander insertion surgery. And I'm getting ready to take my second shower with the special soap that the plastic surgeon gave me. And then I'm going to get dressed and get out of here and head to the hospital. So I will see you in the next clip. Good morning. I'm officially in the car on my way to the hospital. So I'm gonna get there, get checked in, do all that fun stuff, and then I will check in as I go. So I'll see you in the next clip. to let them know I'm not pregnant. Also, I had to rub my nose with these beta iodine, whatever, to sterilize your nostrils in case any bacteria is colonizing in there because of the breathing tube. So it looks like I have a bloody nose, but I don't. See you in the next clip. Okay, so I just scrubbed down and got my gown on and my socks. And now I'm waiting to get my IV. All I have right now is that pulse ox reader, but I will be getting an IV, and then I'll let you know what happens next. So I'll see you in the next clip. All right, so I just met with the anesthesiologist. All is good. I am ready with my IV. I will be getting a antibiotic as well as the saline, just like last time. And I think that's really cool because it prevents having any type of infection going through your body during surgery. So that is awesome. I'm waiting for the surgeon to come in and mark me up. And that's probably my last check-in, and then I'll see you when I wake up. All right, see you in the next clip. All right, so I'm all marked up, ready to get my expanders, and I'm gonna get wheeled back. So I probably won't record anything after this until I'm awake. So I will see you in the next clip. All right, well, I'm out of surgery, tired, covered in whatever that is, and getting discharged. So eating some pretzels, and I brought the wrong protein shake. I'll explain it later. All right, so I'll see you in the next clip. Hi friends, it is Tuesday, March 19th. It's nighttime. I'm home, and I've been home since like 6 or 6:30. Oh my gosh, I'm so tired. I feel like I partied all night and had to get up early for work, and I'm just dragging. I was feeling okay earlier, and then after I tucked my daughter into bed, I was like, oh no, total throw up everywhere. Well, not everywhere, in the toilet, but so much. And it was just all water. And I had a protein shake, like slowly. I drank it very slowly over the course of, I don't know, an hour. And that came up. I don't know, my body just does not like anesthesia. Plus, I guess just like the stress of everything. But I don't know. But I ended up with 2 drains. I have one on each side. The pain level's really low, just like it was for the mastectomy. It is a little bit sore. I guess I didn't look at anything yet because I don't want to disturb it, but I am sore. Like it feels like a bruise, like somebody poking a bruise underneath my breast, like where they reopened me underneath. So I guess that's expected because it's trauma on top of the trauma that just healed. But overall, I feel really good. I'm just very tired. So I will check in tomorrow and let you know how I'm doing. Oh, and as you can tell, I still have like all this stuff on me from surgery. I can't shower for 48 hours, but tomorrow, or maybe even tonight, I'm gonna use like a wipe or something to get that off because I look ridiculous. But all right, I will see you in the next clip. Good morning, friends. It is Wednesday, March 20th, the day after my bilateral tissue expander insertion surgery. I don't know what the technical term is, but got my tissue expanders put in yesterday. I did end up getting 2 drains, one on each side. They are draining pretty well and have a nice color so far. Got my Steve Urkel pants on, hiked all the way up to the top. They're just really long, so I don't want to trip on them. But I'm feeling really good. It's weird because you can kind of see it. You see it protruding right here a little bit. That's the expander. It's up a little high on this side because my breasts were uneven just before I even had them removed. I have scoliosis. So when I was little, like my ribs were a little deformed from scoliosis. So I'm nice and straight here, but for a while I was like that. So when like before I had my surgery to correct it when I was little, so being like that, like my breasts kind of grew crooked. And my breast surgeon also said, or the plastic surgeon said, a lot of breasts just naturally are not even. So this one's a little higher than this one. But overall, I'm feeling really good. A little sore-ish where the incision is because it was healing and it was pretty much almost healed and then it just got opened again. But nothing unbearable. My pain level 1 to 10 is hovering around a 1, maybe a 2 if it gets a little scratchy feeling or pokey feeling in that area. So I'm very grateful for that. Also, like my range of motion is already, look at that, I still got dye on me. My range of motion's really good. I still can't really go up over the head yet. It's really early to do that, even though I want to do that. And I can't shower for 2 days. So I will shower, what's today, Wednesday, Thursday, Friday, I'll be able to shower. So I'm gonna just update you as I go, probably today, tomorrow, and then after my first shower. And then I'll try to get this video up so you're all updated. But I wanna tell you right now that I am so grateful for you, and I want to thank you very much for all of your love, your support, your comments, your text messages, your emails, your YouTube comments, your Instagram comments, your messages on Instagram, everything. I am so blessed to have such an army behind me, supporting me and loving me and praying for me and rooting me on. And hopefully I am encouraging you, if you're about to go through this same procedure, it's not that bad and you're gonna be okay, and just have faith and stay positive and give yourself grace because it's a lot. But I appreciate you so much and thank you for being here on my journey with me, and I hope I'm helping you or someone that you know, love, and care about in some way, shape, or form. That's my goal on this channel, is to take you with me day by day, step by step, hurdle by hurdle, to let you know what it's like to go through breast cancer, chemo, bilateral mastectomy surgery, and now reconstruction surgery. After I heal a little bit more, so I'm gonna say like 3 to 4 weeks, then I can start radiation. So I will take you along with me on that journey as well. So we are gonna be here for quite a while. And then I have to reconstruct the tissue expanders, because they can't be filled until radiation's all done. So, oh, and my hair's growing back. Like I got some hair up in here where it was bald like forever now. Look at it, so long. So I'm gonna be on this YouTube journey for a long time. So stay with me, and I hope I'm encouraging you to stay strong. All right, I will see you in the next clip. It's still Wednesday, the day after surgery. I just wanted to show you. Of course, it doesn't look as red, but I had like a major hot flash a little bit ago, to the point where I was like, do I have a fever? Like, am I having an infection or something? I'm not. And it just was a hot flash. But also, we had the heat up really high here today, and I had like 2 different shirts on. So I just like stripped down. I was like, I'm just too hot. I drank some more water. I don't know if it's like an after effect of the anesthesia or if it's a hot flash from the Zoladex injection that I got week and a half ago, because they say around the 2-week mark is when your hormones drop, like it actually starts to kick in. So if that's the case, I am not looking forward to having hot flashes. It felt like how I felt when I was on chemo and I had the steroid, like I was coming off the steroid, that type of a flush. Lord help me if this is the beginning of what I'm gonna have to deal with the Zoladex. All right, so I just wanted to show you, yeah, my cheeks are still a little warm. Gotta love it. My chest is a little bit red still. But I did take an oral temperature and it was 97.7. So I don't have a fever. It's not like infection. It's definitely just a hot flash because I'm in clinical menopause. Yay. See you in the next clip. Hello, friends. It is, what is today? Thursday, March 21st. And I just wanted to check in real quick because I am feeling pretty good today, and I can't wait to take a shower tomorrow. There's really not much to report because I'm feeling pretty good. I feel the same as yesterday, if not a little better. And yeah, I'm going to take a shower tomorrow, and I will probably feel a lot better after that, because I just feel like taking a shower right now, because I just feel, first of all, I feel gross. Second, I just want to get the incisions wet because they're starting to heal, which means they're like tight. They need a little bit of water on them. And there's also like tape. It almost looks like masking tape that's on them, and I just want to take that off too. So yeah, that's pretty much it. I'm so boring today. My daughter's at school, so I've been like trying to get work done and just get caught up on some things, make phone calls without a toddler screaming in the background. It's been pretty glorious. But I will say, this morning when I woke up and had to like sit up and get out of bed, just for like a second, I was like, oh yeah, that's a little sore down there, a little scratchy right on the incision line. I don't know if it's the expander so much. I think it's more the incision healing, because it was healing and almost healed and then got reopened. But it doesn't hurt during the day at all, so that's good. My pain level's still at a 0 or a 1 at the most. But yes, that is it for now, and I will check in tomorrow after I take a shower, and I see you in the next clip. Good morning, friends. Guess what today is? It's Friday, and you know what else it is? It's the day that I get to finally take a shower. I'm like dying to take a shower and get this off of me. It's so scratchy. Listen, that's all Velcro. It's just like scratchy. It's like super hard right here. It keeps riding up. I just want to take it off. And I remember when I had my bilateral mastectomy, my plastic surgeon said it's okay to just wear nothing. It was just the first couple of days, because this holds in a bunch of pads just in case there's like bleeding, but I don't have any bleeding. The pads are completely clear. So can't wait to get this off, bathe it, get some water on there, some hydration. I can't touch them yet. I mean, if I'm following the same rules as last time, you don't touch it for about a week or so. And then once you get clearance from the plastic surgeon to go ahead and actually wash the wounds, you can actually touch them and get soap on them. But for now, I'm going to get my lanyard on, clip my drains up to the lanyard, take my shower, and just let the soap and water run over them, over the incisions. So other than that, I'm feeling really good, surprisingly. I will admit, to anyone out there who also agrees with this, getting out of bed, like going from laying down to standing up, I don't know if it's gravity or what, but there is a little bit of like tension on the incision because the expander's there. So I guess it moves a little bit with your body when you sit up. And it's just for like a split second. And then once I'm up and moving around, I don't feel them anymore. But my drains are putting out a red color, which is normal. It should switch over. It keeps going in and out from like red to like a little bit of apple juice to mostly red, because I just had trauma 2 days ago. So it's a normal response from the body. It should be putting less and less out each day and getting lighter and lighter each day. So if you're going through any type of mastectomy surgery or tissue expander surgery and your drains, your JP drains are looking similar, you're on the right track to recovery and healing. All right, I'm going to take my shower, and I'll see you in the next clip. Good morning, friends. Today is Saturday, March 23rd, and it is a gloomy, dark, boring, rainy day outside. Yeah, it's not zooming in on that, but it's dark in here. I just wanted to pop in and let you know that I'm doing really well. I did take a shower yesterday, which was glorious. I have to take one every day actually now, from now for a week, 2 weeks, I forget, just to get the incisions wet. There's my lanyard that I wear in the shower to hold my drains, and my drains are doing really well. They're still reddish. They're switching over to like the pink rosy color, which is totally normal, and everything's on track. And they're not putting out like a whole ton, so that's a good sign too, which means I'm healing. Like this was from last night before I went to bed, so not that much at all, which is really good. But yeah, overall I feel really well. I woke up this morning and it was a little, again, like getting out of bed, it's a little scratchy, like right in here, like right underneath where the incision is, but I don't know if I'm allowed to show my incisions on YouTube. They might flag it for nudity. So I want to show you just for like health informative purposes, but I don't want the video to get taken down either. But my incision, where she went in, she didn't even touch the one that goes vertical. And it doesn't even look like she touched the whole horizontal one either. I think just like a part of it, because I'm like, it's completely healed on the sides. And like, that was my old incision from the mastectomy or bilateral mastectomy. So that's probably why it doesn't hurt so bad, because I wasn't like completely opened again. I don't know, but I'll take it. And it is a little scratchy. Like, I don't know what the word is to use, but it's like a scratchy feeling where that incision is, because it's new trauma. But overall, once I'm up and moving around, I don't even feel them. Like, they're fine. They don't hurt at all. They are a little hard here-ish. I don't know if you can see. Let me turn to the side. Can you see? Yeah, this is like the edge of the expander. See how my finger can like push down around it? Kind of creepy looking. Let me see this side if you can see that too. Hold on. I have to have like the right lighting so you can see a shadow of it. Yeah, this side's not so much, but anyway, the right side that I just showed you, it's a little wonky over here. See how there's like a divot? That's like rock hard. That's the expander. There's no tissue here. This is like total expander. And I think it's because there was so much lymph node involvement and like scar tissue. So I just hope when that re-expands, it's not like a ski slope in there. It'll actually round out like a breast, or at least flatten out like how a breast would slowly drop and then round out. We'll see how that goes. But anyway, I just wanted to update you. I'll probably close this video out today, Saturday, so I can have it edited and up maybe by Sunday, and have you all on the same page with my journey, knowing that I'm doing well and everything's going good so far over here. I have a follow-up appointment on Monday with my plastic surgeon to potentially take the drains out if they're not putting out a ton of mLs. It has to be under 30 cc's or mLs per day. And as long as everything looks good, she'll probably take them out. If not, then whatever, I'll keep them in another couple days or a week, which I hope doesn't happen. Because you know me and my Christmas ornaments, I want them off. They get stuck on things and it's just a hassle. So I'm going to check in with you later tonight probably and close this video out. So I'll see you in the next clip. Hello friends, it is Saturday night, March 23rd, and I am going to close this video out here because there's not really too much more to report, but I did want to tell you, and I keep forgetting to mention this, it's like so huge for me. Both of my bottom eyelids have a full set of lashes. They're teeny little, tiny little nubs, so I can't really like show you them yet. I'm gonna try to get a picture of them like maybe tomorrow and sneak it in here before I edit. Maybe not. It's hard to get a pic because they are so tiny, but when I get like real close and I start to do my makeup and I turn to the side, I can see, you can't see it now because my eyeliner's there, but they're little nubbies and it's the whole row. But everybody showed up to the party and they got the memo that I put out a couple videos ago. I was like, tell your friends to join the party. They did, and my hair showed up. Like, everybody's just showing up. Like, look, I got some hair coming in. I'm pretty excited about that. The top lids are still a little scarce. They're coming in, but they're like random. They're not like a full lineup like the bottom is. Whatever, it'll come in when it's ready. I also wanted to let you know that my cheeks, remember they were like, they felt numb because I had no peach fuzz. That was the weirdest feeling ever. That was from Taxol. That hair is coming back in too, because I noticed yesterday when I did my makeup, I was like, I don't feel numb anymore when I put like powder on my cheeks with the brush. It used to feel really weird, but now it feels like my face again. So that's exciting. My face is coming back. Like, I never thought I'd be so excited to like be hairy. It's been so silly. It's the little things that you take for granted, really, in life or about yourself, that you don't know what you had till it's gone, and chemo took it away, but now it's back. So I'm like, oh my God, I missed you. I love you. Thank you for being hairy. As far as the expander surgery goes and this whole video goes, everything's going really well. I'm very grateful. that I'm healing really well. I've been eating really well, lots of protein, lots of veggies, and lots of hydration. Super important for recovery. It helps your body bounce back quicker. So if that's something you're going through, you want to make sure you keep your protein up because it helps with recovery. And rest, hydration, and protein are like the main three things for sure. But I wanted to thank each and every one of you for all of your well wishes, your love, your support, your care, your concern about me, all of your loving comments and your messages on Instagram, and if you know me personally, your text messages, your phone calls, and even those of you watching who have stopped by. I appreciate all the love. I'm so grateful to have so many people who love me and care about me during this journey. It's a wild roller coaster of a journey. I'm going to be like in rest mode, I guess, right now for the next, I'm going to say like 2 or 3 weeks. I mean, I go Monday for my post-op follow-up, so I'm going to take you along with me on that. And I may or may not get drains out, and so I'll take you along with me for that too. And then I have all these follow-up appointments. I have a follow-up with the breast surgeon, follow-up with my oncologist. I have to get another injection, the Zoladex injection, because that's monthly. I have another follow-up too. Oh, radiation. I still have to go to radiation and set up the planning because that got postponed because of surgery. So that's where they're going to tattoo my body, those little dots in the area, and make sure, do a chest CT to make sure that they target the correct area where the cancer was and the lymph nodes, and then do planning. Oh, and I have physical therapy too. And a dentist appointment. Like I have like so much stuff coming up. Life just goes on, life just goes on, and I just, strap up and go for the ride, and you come with me. So we're gonna have a long journey together, and I hope I help encourage you on your journey by walking alongside of mine with me. I wanted to let you know, if you are on your journey and you're getting ready to have your surgery, whether it is like a mastectomy or a bilateral mastectomy with reconstruction or without. Mine was supposed to be with reconstruction, but stuff happened, and there's like a video I put up of that whole spiel, which if you've been following me, you know what happened. And that's why I had to get the tissue expander surgery separate. So I had to have 3 surgeries to reconstruct my breast technically and get rid of the cancer instead of 2, because the final surgery, the third one, will be the implant, like the permanent implant, and that's not going to be for quite a while, like probably, I'm guessing like Christmas time or even January of next year, because it takes a while to, I have to get through radiation. That's 6 weeks. I have to heal, so there's like 3 to 4 weeks. Radiation is 6 weeks. Then we expand weekly for, who knows, 2 months, 3 months. Then whenever I'm at my desired size, which isn't even going to be like huge, because I don't want to be as big as I was before, because I was not comfortable. I'd rather be smaller. Then you wait, like say I'm at my max fill, whatever, it's my last fill. You have to wait, I think it's 3 to 6 months, 3 to something, at least 3 months or more, to let your skin just chill and your tissue just gonna chill for a little bit and stretch and just get comfortable. And then you prepare for surgery to take the expander out and put the implant in. So it's a long journey. All the while that's all happening, I see my oncologist every 3 months. I get blood work monthly. I will be on a chemo pill. Well, it's a targeted therapy pill. I will be on a hormone pill. I will be on my monthly hormone injection, and I will be examined when I see my oncologist every 3 months. She will examine me to check for any new lumps or anything that might signify, hey, there's a new cancer forming. Hopefully that never happens, but it's an ongoing, forever long journey. So I hope you stay with me on my journey, because I am just hoping to inspire people to stay positive, take things as they come, because we only have today anyway. So try to be happy today, or find something positive that happened today, even if today's a bad day. And I also want to encourage you to try to focus on healing and just getting through what's in front of you right now. It's a really long road when you find out that you have a cancer diagnosis. All of the treatment is like extremely overwhelming. It just seems like it's going to take forever, but you just want to take things one day at a time, one hurdle at a time, because there's going to be hiccups, there's going to be delays and setbacks and obstacles, and very rarely does it just go completely smooth. So just try not to let it discourage you or keep you down too long. But yeah, that's pretty much it for this video. I hope it helped you in some way or helped your loved one in some way if they're getting ready to have their tissue expander surgery, what to expect, how to care for yourself afterwards. Just make sure that you're taking care of your drains properly and milking them at least once or twice a day. I have a whole video up on how to care for your JP drains. Maybe I'll link it here in a card, like a little thing that you can click on so you can watch it. And make sure that you subscribe to my channel because I put videos out every week, usually like once or twice a week if I can. And I'm always trying to help in some way. So I am gonna sign off for now, but I will see you soon because I have doctor appointments coming up and radiation coming up. So I hope you are having a lovely weekend and have an awesome week ahead. Remember to smile and let your inner light shine. And I better see you in the next one. Bye.